Okay, this is a great segment. Y'all are really going to get a lot of information from, because you probably know about physical therapy, right? But what about pelvic floor physical therapy? We are talking pelvic health and how it really matters to your overall health. We've got Limitless Therapy and Wellness here, Dr. Katie Fincher. We are excited to have you because pelvic floor, we think at first, when I think of like all the pelvic floor exercises and what it can do, you think, okay, a lot of people that have given birth and
Absolutely.
that are trying to make sure they don't tinkle a little bit when they jump.
Of course.
Or laugh too much, because that's the thing that happens.
Yes, absolutely, absolutely. And that is so common in that phase of life, but it does not mean it's normal.
Okay.
And that is something as a pelvic floor physical therapist that we can certainly help address and treat and help people stay dry and enjoy the activities that they really like to do on a daily basis.
Because sometimes, like, you know, if you can't kind of do it and do some of the exercises, then, you know, people have to do surgeries, and that can lead to all kind of crazy things.
Absolutely, absolutely. And there's so much conservative management that can happen before that's even a thought. And what's really nice is that pelvic floor physical therapists, just like myself, are able to help women understand that, understand their bodies, and be able to identify exactly what's happening so that they can, again, enjoy those activities without necessarily having to have surgery as that first line of defense.
I love that. First, let's talk about, when should someone even come talk to you? And then is it like a referral thing, or do they just call you and be like, Dr. Katie, everything y'all talked about on the show, I'm experiencing?
Yeah, no, that's a great question. And there's definitely some misconceptions out there in the realm of pelvic floor PT. But in regards to what the pelvic floor therapy actually treats, is we do treat the pelvic floor muscles themselves, which are these red muscles here at the base of our pelvis. And so these affect urinary, bowel, as well as sexual functions. So if someone's experiencing difficulty with any, like, holding their bladder or even emptying their bladder, same thing with bowels, as well as sexual dysfunction, so pain with intercourse, intimacy, anything going along those lines, that's an excellent time to be able to reach out to a pelvic floor physical therapist, as well as postpartum, during pregnancy.
Yes.
Like, women experience a lot of pain sometimes during those times, or even some of those pelvic floor symptoms. And so that's an excellent time frame to be able to reach out to a pelvic floor PT and say, hey, like, I'm experiencing some issues in this area, kind of what are some ways that we can kind of help address that?
See, that's so good, because I think so many people just expect, well, this is what happens. I gave birth. I'm just going to have to, you know, not jump on trampolines anymore. Or you're like, no, it doesn't have to be like that.
It does not have to be that way. And I have this conversation in my clinic with my patients literally every single day. I'm like, this is common that you're experiencing this. Again, it's not normal, and we can help you overcome these barriers to kind of you being able to, again, enjoy your goals and be able to achieve those goals.
And what are some things that you would do? Because, you know, we all said, oh, you know, do the Kegel exercises or do this. Is that like a real thing, or are there more things that you got to be
Oh my
doing?
gosh, so much more. Have you ever heard the stoplight, you know, do your Kegels at stoplights?
Oh, yes.
Yes. So that is not a great recommendation anymore. So from a standpoint of pelvic floor PT, what it is not only Kegels, y'all. If you are experiencing pelvic floor therapy and you're just laying down trying to just contract your pelvic floor, that's a small part of the process, but our pelvic floor functions in a whole system. So if we, as a physical therapist, we have to be able to address those pelvic floor muscles as well as all the muscles that are above it as well as below it, because these muscles, they don't function in isolation. So we have to be able to assess and address exercises that address your core, address your hips, address your feet, address your shoulders even. Like, these muscles are so important in how they function in a system. So when you come to see us, we are addressing that whole entire system, not just the pelvic floor and not just Kegels.
That is so smart. It's all of this, not just that one
exactly.
little part.
Yep.
Okay, and last tip, because I talked about this beforehand.
Yeah.
Okay, a lot of ladies, like, sometimes when you go to the bathroom, like, you maybe not be in the cleanest place, think like college, or kind of running.
Sure.
So maybe you try to go real fast. You say, no power peeing.
No to power peeing.
That's that. Like, I love that, though.
Yes. So your bladder itself is a muscle, and that muscle is what's contracting to help get your urine out of your bladder. Your pelvic floor muscles, they just need to relax during that time. And if we push and we use the pressure from inside that abdominal cavity, if we do that chronically, we can actually weaken those pelvic floor muscles, and that's not something that we want to be able to do.
So, see, your pro tip for the day, no power peeing.
Yes, no
okay?
power peeing. Just breathe, relax those hips, relax your muscles, and just let it empty.
And let it be. Dr. Katie, you are fantastic. Where are you located and how can we get in touch with you?
Great question. So we are located in Toy Street in the downtown office. There we are also mobile. So I am on wheels. I can come see clients in their homes. We also have another location on Woodruff Road at B3 Strength and Performance. So I also treat patients in that location, particularly people who are athletic, wanting to get back to activities without leaking, that kind of thing, as well as addressing like hip pain, back pain. You know, pelvic PT is not just limited to the pelvic floor muscles. Like, we're addressing the whole system. So all those 3 locations will be where we can kind of
Thank you, Dr. Katie. Very good. Super cool.